Okay. Thank you, everybody, again for joining the Injury Prevention Plus Seek Way 4 Action Period Call number 2. We are happy to have you today on this call. We have kicked off the program. We are in the middle of it. It hopefully is going well for everybody. This is one of our educational sessions that is part of the program. We have a really good session today for you. We have some guest speakers. Okay. And really excited for the content of this call. We will get started. Thank you, as always, to our program partner, the Ohio Department of Health, the Violence and Injury Prevention Section, or VIPS. You are welcome to ask any questions or have any comments throughout the session, but if you are not talking at this time, if you don't mind muting, that would be great. Okay, the agenda today, I will continue to admit people. Welcome all of you, and we will take attendance. Zainab will have a nice data summary for us. Excited to hear from Nicole from Triple P and Judy from Cribs for Kids. Depending on time left, we will go through some QI Toolbox findings, some reminders, a little plug for our annual meeting, and any questions that you have. Okay, if you don't mind sharing in the chat your name, your role, your organization, and what county you are in, please. Okay, and Zainab, I have your slides. If you are ready to go over the summary, that would be great.
Yes, I'm ready.
Thank you.
So I'm sorry if there's a little bit of background noise. I'm not where I expected I would be at this time, so please bear with me. So for the first few slides that we have here are going to have some baseline data. I know most of you submitted all of the baseline data we requested. I know we're still waiting on. I know we're still waiting on some additional data from some of the practices, and I would appreciate if we could get that so that we could update these slides for you. But here you can see we have topic addressed and resource given in these charts, in this one and the next chart as well. And so you can see here where social needs, about 36.4% of the time people are asking about social needs. And then resources are given to about 6.2% of those people. And so after speaking with some of the practices, I know that some of you guys weren't giving yourself enough credit for resources given. I know some of you said that you were giving out diapers or you were giving out some other kinds of resources, and that if it wasn't a paper resource, then you didn't consider it as a resource. So I would just take this data with a little bit of a grain of salt when looking at your performance together as combined practices. And you can see here family needs also is a pretty low. So there's a lot of room for improvement for social needs and family needs. But as we get to home safety, car seat safety, and safe sleep, it looks like the majority of the practices did pretty well in addressing those topics, asking about, if the seatbelt is, if the car seat is installed correctly, if it's been tested by someone that, like a nurse or a firefighter, safe sleep, whether the baby has his or her own crib, if they have other smaller toys around them, and then home safety. And then resources, you can see the resource tab. Again, it looks like some of you, didn't give yourself enough credit for that. But then we had a few practices that said that, they ask about home safety, car seat safety, and safe sleep to all of their patients. So that's why pretty much you can see higher prevalences there. I would say there's a little bit of room for improvement, but having those steady and maintaining those levels would be the goal here. And I'm ready for the second slide. And so this is also baseline data, but it's for the that older age group, 13 months to 5 years. As you can see here, social needs and family needs also are on the lower end, below 50%. And then as we go to home safety, car seat safety, and safe sleep, those are in the higher, higher trends, higher levels, higher prevalences of, addressing those topics, asking families if they need help with any of those topics, and as well as giving resources. And the next two slides are preliminary QI data. I know by the time that Brooke, I asked Brooke to send me this data, it was the middle of last week. And I know a lot of you have probably submitted additional data. So this is data as of last week. So it would be, very important to know that this is not all the data that you guys have submitted so far. And I know that maybe some of you had issues with submitting data, but again, this data is as of last Wednesday. Overall, all of the practices combined submitted about 43 records. So you saw a total of 43 patients the first few weeks of September. And 38 of those 43 patients received the resources, whether it was AAP provided resources or other resources that you had in the office or in the practice. We weren't specific to what resources were given, as long as some sort of resource was given, and that's 88.4% of the total number of patients, which is amazing. And as you can see here, I was a little bit hesitant in how to display the data. So what I did was, in the blue bars, you have the number of patients that indicated that there was some sort of concern. So whether you ask about social needs, if you ask the family, hey, do you need some resources to the job center? Do you need help finding a job? And if they said yes, just of those questions, 11 individuals or 11 families indicated a concern or said that they needed help with that. And 100% of those received the proper discussion or the proper resources that they needed to help with that issue. And you can see here, the least commonly, or a topic with the group that had the least amount of resources is home safety. And looking at the data, I think the issue here is one of the questions for home safety is whether or not they wanted the number for poison control. And if they said yes, pretty much sometimes the physician was saying not discussed, because I'm assuming that you knew that the number for poison control was in the resource sheet. So technically you didn't really have a discussion there. So that is bringing this a little bit, that is bringing the resource or the discussion for home safety to about 66.7%. But overall, we're in the 70s, 80s, and 90s range for the rest of them, which is also pretty good. And here, just so that it's clear, these numbers above the bars and the values of the bars represent the number of patients. And then the little chart on the bottom represents how many of those that said that they had a concern had a discussion to follow to address that concern. And so I'm ready for the last slide. And again, here is the older age group. As you can see, concern for social needs decreased for that older age group. A total of 52 patients were seen from the ages 13 months to 5 years, and 45 of those 52 individuals, or 86.5%, received resources. And again, those resources can be the AAP resources or other resources that you think or the physician thought was beneficial for those patients that that requested it or that needed it based on any concern that they mentioned. And so you can see here, social needs, only about 40% of those individuals that indicated some concern said that they needed or that indicated some concern had a resource provided to them. And then we have family needs and car seat safety. Over there in these two, you can see pretty high prevalences of resources given or rates of discussion. And then home safety, again, we see pretty low, about 60%. And again, the same applies to this group where the poison control question kind of pulled that rate down a little bit. So once we start dividing the data by practice, I'll be able to give a little bit more information about, how many patients said that they wanted the number for poison control and whether or not they received resources to eliminate that not discussed. So these rates could potentially be a little bit higher once we start dividing the data. And so that's what I have prepared for today. If anyone has any questions about what I presented, go ahead and please, ask, or if you want to talk in a private call. I know Brooke can get us in contact, or you can contact me anytime. So this is what I have prepared for today.
Thank you, Zainab. Yeah, you can unmute today or put your questions in the chat if you have some questions for Zainab. If you haven't already scheduled your first practice coaching call, Zainab comes to those and runs your data, and we have a little discussion on how it's going and give you a little insight into your information you've submitted individually. So we encourage you to do that because there's good information shared. Okay, hearing none right now doesn't mean you can't ask later. We will move on.
Definitely.
Okay, there is a question in the chat. Can you tell us how you are pulling this information from the practice? Yeah, Zainab, do you want to touch on this baseline versus
sure.
screening tools? Okay.
So baseline, we sent a survey link, and that information was entered by the physicians from the different practices. And in terms of the QI data, once you submit your data through the iPad, it is stored in a external server, and then a PDF or an Excel spreadsheet is downloaded from that, and then I look at the data that way. So all the data is stored from the iPads to that server, and then it's sent to me to analyze.
I hope that answers your question. Any other questions around data right now? Okay. Zainab, thank you so much. Right now, we will move on to Nicole from the Ohio Children's Trust Fund to discuss Triple P. Nicole, I got your slides.
Great, thank you. I am Nicole Silliman. I'm the Interim Executive Director at the Ohio Children's Trust Fund. Next slide. And our mission is to prevent child abuse and neglect through investing in strong communities, healthy families, and safe children. We are the state's designated state lead agency for the Federal Community-Based Child Abuse Prevention Grant, and we are also Ohio's Prevent Child Abuse America state chapter. Next slide. I'm just going to give a little bit of background just so folks are familiar with who we are and what we do in Ohio, but I might move through these fast for the sake of time. We are a quasi-governmental agency. We're housed within ODJFS, the Office of Families and Children. We also report to a 15-member board. You can just go to the next slide. It has our board members. We have 4 legislators, 3 agency directors or their designees, and then 8 public members appointed by the governor. We are down 1 board member, which is why you only see 14 right now. Next slide. And we just like to show how we sit within Ohio's child maltreatment continuum of care. I think it's just helpful to kind of orient our audience to us. And so, as I mentioned, we're within Job and Family Services in the Office of Families and Children. And then within their office, they oversee Ohio's Public Children's Services Agency. And then we are also within the office, but we oversee Ohio's 8 regional prevention councils. And so just as you're thinking through the lens of primary, secondary, and tertiary prevention, this is how it all sits together within the Office of Families and Children. Next slide. And then this is just something I like to share when we think about the different levels of prevention. There's, many definitions of prevention. And so statutorily, services funded through the Ohio Children's Trust Fund support primary and secondary prevention. And so these are services for families prior to a known report or confirmed case of child abuse and neglect. And then tertiary prevention is then the response preventing the reoccurrence of child maltreatment. And so most of everything that we do is in that primary and secondary prevention lens. Next slide. And then what we're going to talk about is really how we have expanded and taken a universal health approach, or a true primary prevention approach to supporting Triple P online for Ohio families. Next slide. And so the trust fund has really been funding Triple P, the parent education, either the in-person or virtual group-based services for about 15 years now. And we were introduced to the Triple P online program probably like 5 or 6 years ago. North Carolina was really a leader in the launch of Triple P Online, and they took this public health approach. And so we've been interested in trying to fund it for many years, just didn't have the resources. And then with ARPA funds, we're able to work with the Governor's Children's Initiative, as well as with JFS to really take this statewide. Next slide. And so Triple P, the reason why, we cared so much about taking this program statewide and making it available to all Ohio families is because this truly is a program that meets families where they're at. It really focuses on providing the service at the right time, at the right place, with the right amount. And so, a family can take it online in the comfort of their own home. They can take it at any hour of the day. If they need additional supports or want to be connected with a group or an in-person provider, there are mechanisms to connect them with a group setting, connect them with the provider. And then also it's really geared towards meeting the families where they're at pertaining to dosage. Some families truly only need a 15-30 minute brief consultation about, how to get their kids on a good bedtime routine, versus other families really need intensive consultations about handling, challenging childhood behaviors. And then some families might need some help just kind of managing their own stress. And so that's why this program is really geared towards that right time, right place, right amount. Next slide. And so Triple P breaks its services down to levels. There's 1 through 5, where 5 is the most intensive, it's the most individualized. And then level 1 is really that general communications awareness campaign. And you can go to the next slide. And through the Ohio Children's Trust Fund, we have been really funding levels 2, and then new to us in the recent couple of years is levels 5. I should say 2 through 5 is what we've been funding over the past several years. The trust fund is not the only group who funds this program. It's been supported by other state agencies in the past. And so this is just a snapshot of where our funding goes to support this program. So level 2, those are those light touch, brief sessions that I was talking about. Providers can do what's called seminars, and those are 90-minute topics on specific, or 90-minute sessions on specific topics, or it can be those brief consultations, 15-30 minutes, just to kind of one-off ask questions pertaining to a particular issue. Level 3, these are group-based sessions, and that really gets to like a discussion group pertaining to managing childhood behaviors, bedtime routines, grocery shopping with your kids, different things like that, lots of parents just might need some additional support on. Level 4 is more of a multi-session. It can be home-based or it can be group-based, and it's about 8 to 10 sessions that are working with parents through specific parenting practices, parenting behaviors, different topics to address the needs of the families. And then level 5 is that much more intensive service provided to parents who are really struggling with, maybe their own self-regulation skills, as well as handling some difficulties within the household. Next slide. And this just goes to show you, this is an extremely researched and evidence-based program. And so there is lots of evidence out there demonstrating the effectiveness of Triple P. Next slide. And so, Triple P is really geared towards helping parents work through like self-regulation and self-management, really trying to utilize the strength-based approach. Parents get to determine their goals, their needs. They get to pick the sessions that make the most sense to them and really relate to what challenges they're having within their own household. And then practitioners are trained then to provide relevant examples and to really kind of tailor their approach with the family based on the family's needs. Next slide. And so in May of 2022, we were able to launch Ohio's Triple P website. And what this website has is basically everything that you could want to know about Triple P and how to access both the free Triple P online program, as well as being linked up to service providers throughout Ohio. And so if you all are interested in referring families to take the online Triple P program, you would just direct them to the website shown here. And I know I've sent over some information to Brooke as well to have that posted on your website. And then families are able to, they can sign up if they're interested in taking the Triple P online program. The online program is the level 4 program. And so there are up to 8 modules that parents can work through. It's self-paced, it's at their own time, at their own hour. And then if they don't need all 8 sessions, then they can, stop when they feel like they've had enough resources and had the supports that they need. And then additionally, just some other resources that are on the website that I want to call out. There are like blogs and parenting tip sheets and, different information that may be beneficial if you just want to, direct them to like listening skills, communication, how to bond with your kids, getting back to, a healthy routine now that we're back in school. So there's a whole bunch of parenting resources that are on this website, in addition to accessing the Triple P online program, as well as accessing the group-based services as well. Next slide. And then if your parent, is, or you're aware that they may be interested in connecting with a service provider who is trained in Triple P, under the free parenting courses tab, there is like an actual map for Ohio where they are able to indicate like their zip code, their city, and then find whether or not there's any free services throughout Ohio. And so they can just go here and then look up a Triple P provider. And then as you can see at the very bottom, there's like a register here. And then I saw something in the chat about is Triple P for all insurances. And I just want to make sure the Triple P program is being provided to families for free. And I don't know if that's answers your question. It's a free service that we're funding, and other entities throughout Ohio are funding it for families. So families just go onto the website and they would register for themselves. I don't know if that answers the question. Next slide, please. And then something I just want to call out real quick is we're also working in partnership with, our partners in childcare, and they are supporting the Triple P Positive Early Childhood Education Program. And this is really geared towards training early childcare providers in the exact same techniques that parents are receiving pertaining to the Triple P topics and how they model the behaviors for kids, really thinking through the lens of if both parents as well as providers are trained in the same approaches as we're responding to the needs of, our kiddos, then we're taking this unified approach where everybody is responding in a strength-based manner as we work, with our children. So it's really kind of ensuring that kids see that behavior modeled not only at home, but also in their childcare settings. And so that is also being promoted. There is a link at the bottom for early childcare professionals to participate in the PEACE program online, as well as to access coaching. And you can go to the next slide, please. And this just shows you the 2 elements of the PEACE program that are available. Next slide. And then just some key highlights in my last minute or two. Like since we've launched this program at the end of May, we already have over 2,600 parents representing 87 out of Ohio's counties This data was pulled a couple of weeks ago. So we're hoping by now we're up to all of 88 Ohio counties who have parents taking this program. Additionally, we've been working on strategic marketing and promotional materials to time this up with the back to school season. There's going to be different ebbs and flows depending on, different holidays, different things that are happening. And so we'll have strategic marketing rolling out over the next year. We also have some great letters that providers can send out to parents that have what we're calling an easy access card. It looks like a coupon code that's provided at the bottom of these letters that have a QR code that takes the parent straight to the Triple P Online website so that they can register for the course. So trying to come up with a lot of different mechanisms to get this out to parents so that they know how to sign up and enroll in this program. Next slide. And then for more information just on the trust fund, if you're curious to learn a little bit about us, here is our website. And I think my information is provided as the last slide, but I'm happy to answer any questions any of you may have.
Nicole, thank you so much. Not to derail anyone from thinking of their good questions, but while you are doing that, I just want to remind you that most of you were sent the Triple P resource with the coupon that Nicole generously gave to us and I sent out to you guys. Hopefully you have started using that, but maybe you wanted to wait until after today's presentation to use that, but feel free to pass it out to your patients and families. I just want to reiterate that the Ohio website for Triple P was added to the Seek resource website this week. And I was impressed by the 87 of 88 counties in Ohio. It has implemented this in some capacity. I think that's an impressive statistic. And not to put anyone on the spot, but I do know that some of our participating practices have used Triple P. And if anybody would like to comment on how it's going for them, I'm curious to hear.
This is Tracy at Perrysburg Peds. Yeah, we use it pretty consistently. I was not aware about letting the parent go online. We have an actual, I believe, form that that our staff fills out, I think. But yeah, I've had very good response from parents who have utilized the program.
And the online program is brand new. So
Okay.
Yeah, we just launched that
Okay.
In May, at the end of May.
I missed you saying that, sorry.
What is the decision point or the work involved in picking or deciding what level someone starts on?
So if a parent would like to do this on their own and at their own pace, the Triple P Online program is really the beneficial one to take. And then if they're just, I think it's all dependent upon your relationship with the parent and knowing their needs. If they just need a little bit of help or support, it might be, just the seminars or the discussion groups. But then if, a family is really kind of talking through some more intensive childhood behaviors, then trying to find a provider who's trained in level 4 or above would be beneficial.
Okay, thank you. Any questions for Nicole? You have her email here. You can go through me. You can certainly go on the website, review the handout. A lot of good resources to tap into Triple P and the Ohio Children's Trust Fund. Okay, hearing none. Thank you, Nicole, so much for this really good information. I appreciate you being here. Okay, next up is Judy Bannon, the CEO and founder of Cribs for Kids. Judy, we talked earlier, your tech was working and I have your slides.
Good. Thank you so much, Brooke, and thank you for inviting me to this webinar. I always like when we're included in prevention webinars. So often we're tied in with maternal and child health and really safe sleep and providing cribs to families. is a way to prevent babies from dying and not being able to celebrate their first birthday. So thank you again for the invitation. I'm going to begin by, and you can go to the next slide, Brooke, by taking you on a tour of Cribs for Kids, which is located in Pittsburgh, Pennsylvania, not far from all you wonderful people in Ohio. And here's our tour.
Hi, Judy. Sorry, I'm working on getting the audio for you guys.
Okay.
Please hold.
Thank you, Brooke. That's a little bit of an introduction to you of our Cribs for Kids program. I wanted to give you a little bit of the background of how we got started and when we got started. It was in 1998 when Back to Sleep was pretty much being taught every place, and our SIDS rates were starting to go down because babies were being put on their backs to sleep rather than their tummies. And we had gone in Allegheny County from 54 deaths a year down to 28 deaths by 1998. And to me, those deaths were still way too many. So what we discovered, because we held support meetings for bereaved families, was that the families who continued to lose babies were low income. A lot of them were African-American families. In our more affluent families, babies were not dying of SIDS. So we did a study with our coroner, Dr. Sarah Wecht, and we discovered that 90% of the babies that continued to die, what at the time was being called SIDS, were found in unsafe sleeping environments. Families could not either afford to have a crib, or because of their culture, they were taught to sleep with their infants. And the babies who all of a sudden weren't dying of SIDS were from more affluent areas where cribs were provided and babies were put to sleep in those cribs on their backs. So I immediately said, we have to start a program where we're supplying cribs to low-income families, but more importantly, the education for them to know how important it is that the baby sleep on its back in an uncluttered crib. So we had gone in 1992 from 10,000 deaths a year nationally to, at that time, about 5,000 deaths. And now the CDC is reporting that we're losing about 3,500 babies now to sudden unexpected infant death, which includes accidents in unsafe sleeping environments and also SIDS deaths. SUID is the umbrella that SIDS and all the other sleep-related deaths are over. And SUID is the #1 leading cause of infant deaths from 1 month to 12 months of age. Okay, next slide. So our mission statement is to provide infant safe sleep education through preventive programming, supportive research, safe sleeping environments for those in need, and bereavement support services to families who have experienced the loss of an infant due to SIDS or other sleep-related deaths. Next slide. So we founded Cribs for Kids in Pittsburgh in 1998, like I said, and now we operate through a network of over 1,800 partners nationwide. Our partners consist of health departments, hospitals, social service agencies, government agencies, public safety departments, nonprofits, and more. Since 1998, Cribs for Kids has provided over 800,000 safe sleeping environments to families in need through this network of partners. We also support our partners with programming that is free of charge to our partners. So our business model from the beginning was that if we could supply safe sleeping environments to our partners at greatly discounted pricing from that at retail, the profit that we had built into that price, even though it was greatly discounted, would go into a program where we would be able to provide services to our partners so that they didn't have to recreate the wheel and come up with ways to educate parents and to also provide these cribs through other means. So those programs consist of, next slide, please. Our managed care organization program, and this is a program, I have to begin by saying that back in about 2008, I was invited to talk to the Ohio AAP, along with the Ohio Health Department, about this new business model that I had just come up with. For about 10 years, we were doing the program in Allegheny County, but I realized that this was a program that we could spread nationwide. So Ohio was one of the first groups that I went to. And it's so great to see now that Ohio is one of our most active partners. Next week, we will be going into a new contract with the health department in Ohio to provide over 8,000 cribs to families in need throughout the state. So we've been working with Ohio for years on making sure that their program is really one of the best in the country. And when I was called to Ohio to talk to them, it was because they ranked 49th out of 50 states. They were just ahead of Mississippi in SUID rates. And now Ohio is about 35th. So you keep going up that ladder, and we're really proud of the work that Ohio is doing. So one of the things that we had talked about that day in Ohio was our idea of a managed care organization program, which thankfully has come to fruition. So I looked around and I realized that the insurance companies were the people with all the money, and they were the people providing Medicaid services to mothers, pregnant moms, and a lot of them were doing some type of incentive program. usually consisted of a gift card to Walmart. And that always bothered me because I thought there are so many great things that they could be giving this mother that would not only give her the incentive to go to her prenatal visits or whatever the insurance company deemed was what she had to do, but it would also then help the baby. So I started in Pittsburgh and went to UPMC for You and to Gateway Health Plan and talked to them about doing an incentive program that would give the mother a safe sleep survival kit for the infant, and it would be delivered to the mother a couple of weeks before the baby was born so that she could have it set up in her home and to have a safe place for the baby to sleep and anticipate the baby sleeping in that safe sleeping environment. So they started to do the program, and it was very successful. And now we have about 35 managed care organizations nationwide who are doing that program with us. And if you're working with managed care people and you want to get them interested in doing our managed care program and giving incentives to your patients, the best way to sell it to them, which is what I did, was not so much a heart speech about the babies dying, but the fact that if they started an incentive program and the mom started going to all of their prenatal visits, that baby had a better chance of being born at 9 months and not 7. So that was 2 months out of the NICU for that infant. And those $1 million babies add up, and you could pay for a program like this for years and years to come. So that's really why our managed care organization program is so popular, and it keeps growing by the day. All of the programs I'm telling you about can be accessed on our cribsforkids.org website. So if you want to look into that, if you're interested in talking about it, you can get in touch with the person listed on the website who can explain it to you. Okay, we went from there to, in 2010, I got a bill passed in Pennsylvania that made it mandatory that every mother, before leaving the hospital after giving birth, she had to be educated about safe sleep. So we worked for 5 years to get that bill passed. And finally, in 2010, Governor Ed Rendell signed the bill for us, and we got it through the House and Senate. And it was really wonderful because I tried to come up with a place that all parents, not just low-income parents, but every parent would have access to, and they were the birthing hospitals. So we were doing it throughout Pennsylvania, and I started getting calls from our partners throughout the country saying, could you get this bill passed in my state? And of course I couldn't. I knew people in Pennsylvania, and it took me 5 years. And I said, I probably couldn't do that. So we came up with our National Infant Safe Sleep Certification Program. And what this program does, it took all the tenets of our bill in Pennsylvania, and we put it into our certification program. And now we certify hospitals who are doing safe sleep education. And there are 3 different levels. The hospital can be a bronze certified hospital, silver, or gold. And all of those levels have different requirements in order to obtain them. The gold hospitals have to have cribs on site, so that if a mother comes in and is asked if she has a safe place for her baby to sleep and answers in the negative, then she goes home with the safe sleeping environment, which, at first we started out with the Graco Pack and Play, and now we have developed our own unit, which is called the Cribette, and we'll talk about that later. So this hospital certification program we began in 2015. We launched it officially. And to this, right now we have over approximately 500 hospitals nationwide who have become certified on one of the levels, and most of them are gold certified hospitals. So we have we've developed audits for these hospitals. We keep in touch with them to make sure that they're living up to the standards of their certification. And we're really proud of that program too. And again, it can be accessed on our cribsforkids.org website. We then started looking around because at that time we had a staff of, I wrote a book, in fact, it's called 5 Ladies in a Forklift. And that's how we built our organization. And as you could see from our video, we have about 15 people working for us now. But at that time we had 5 ladies, and forklift donated to us by Pitt Ohio Express. And I want to put a plug in for Pitt Ohio because when I started the program and I had to start shipping cribs out, I had no idea how to do it. So I had my first order were cribs going to Michigan, Flint, Michigan. And I saw a Pitt Ohio truck pass me on my way to work one morning. And I thought, well, I'll call Pitt Ohio and see if they can ship these cribs to Michigan for me, which my husband thinks is the greatest part of our Cribs for Kids story, because I see a white truck with big red letters that say Pitt Ohio, and I have cribs going to Michigan and I call them. But that was a hand of God moment for us for sure, because when I called and it was obvious that I knew nothing about shipping, the salesman asked me to send him an email explaining what my vision was for Cribs for Kids. And he received that email, took it to the owner of Pitt Ohio, and they got back to me on Monday and said that Pitt Ohio would donate free shipping services throughout the 11 states they shipped to. Luckily, Ohio is one of those states. So that was in 2006. And to this day in 2022, with all of the gas prices going out of sight and all the shipping rates going up, we are still proud that we can offer free shipping. And Pitt, Ohio is now in 14 states. So every time they take on another state, we have happy partners in those states who are taking advantage of the free shipping. So, but I digress. I think part of our story is that, you have to just go out and ask people or let people know what you're trying to do, and people can be really generous. And that's what happened to us when we started our National Public Safety Initiative. So we looked around and, we had 5 ladies and a forklift, by the way, that Pitt, Ohio donated to us. And we were running this business trying to get products out to our partners throughout the country. And we needed people, feet on the street and people in the homes in the Pittsburgh area who, because now we're a national organization, we didn't have resources for the Pittsburgh area. So we looked for people who were in the houses anyway, who could be our eyes and ears in the community. And so we started our National Public Safety Initiative. And this is one of our fire trucks from our neighborhood here in Hazelwood, and the firemen that you see with our crib, delivering it to a family. Actually, we started the program in November, and in January of that year, 2015, we came back from Christmas break, and he's standing on the doorstep, and he said he gave away the best Christmas present he ever could have given away. He had gone to a house because a grandmother had had a heart attack, and it was Christmas Eve, and the whole family was there, and there were babies. And he said, "Do one of the babies live in the house?" And the mother said yes. And he said, "Show me where she sleeps." And the mother said, "She sleeps with me." And he said, "Not anymore." And he went back to the station, got the crib and assembled it, and gave the whole family safe sleep education. So that's a program that we're really proud of, and our public safety people are thrilled to be able to take advantage of it. Okay, next slide. Our Safe Sleep Ambassador program is something that pediatricians might be interested in. It's a free service, online service, educational training. We launched in 2018. We now have over 19,000 Safe Sleep Ambassadors. And the mother or the caregiver or the office staff at a pediatric office can get on our Safe Sleep Ambassador program. They can watch a PowerPoint presentation about the importance of safe sleep, take a test. If they pass the test with 90%, and if they don't, they can go back and take it again. They'll get a certificate saying that they're a Safe Sleep Ambassador. So we have people every day signing up for that. And now we have daycare providers having their whole staff doing our Safe Sleep Ambassador program so that they can say to new parents coming in, all of our workers are Safe Sleep Ambassadors and understand the importance of safe sleep for your infant. Okay, next slide. Our at-home program, if you have a patient who's in need of a crib, you can get our at-home program online. You can order the crib through us and we can ship it to the mother's house. We charge $20 for the shipping because with Pitt, Ohio, it has to be at least 10 cribs going at one time. But that's a good program for somebody who's in need. Our cribettes are, I think, superior to the Graco Pack and Play because they're built exactly the same as the Pack and Play, but they have the safe sleep message, ABC alone on my back in a crib embossed through on all the material. So it's a constant reminder to the caregiver that the baby should be sleeping ABC alone on their back in a crib. Okay, next slide. As I said, there's a picture of the cribette, and all of our products are embossed with the safe sleep education. So if on our website, you can go to our partner product catalog and you can see what all we have to offer as far as safe sleep goes. Next slide. Our Safe Sleep Academy is also a free infant safe sleep educational website for parents and caregivers. It houses our Ask the Pediatrician, which is a resource from our medical director, Dr. Eileen Tyralla. So she will answer parents' questions, and then we have an archive of all the frequently asked questions. So that's another resource that you can tell your patients to go to. Next slide. And this is a sample of our all of our products. We got to the point that we had a lot of our partners saying, I'm going to a baby shower and I'd love to buy a cribette for the baby shower, but we couldn't sell our products retail because we could just sell them to nonprofit organizations. So we started a subsidiary of Cribs for Kids, and we call it Etc. All of our products end in "et." So we have the cribette and the snapette, which is the onesie, and the snoozette, which is the sleep sack, et cetera, et cetera. And so we call it Etc. And you can go on to etc.com. So if you're looking for a special gift for a baby shower that's embossed with safe sleep, it's a good way to open up the conversation about the importance of safe sleep by giving them something that has the safe sleep insignia on it. And then it often gets conversations going at baby showers all about safe sleep. And this, what you see there is our baby shower in a box. And we have a lot of our managed care organizations who have put that on as an incentive for the mothers. And it's filled with all of those wonderful gifts for the mother. So we're really proud of our Etc. program too. Next slide. Okay, I'd just like to thank you again, Brooke, for inviting me. And if anyone has any questions, you can email us at info@cribsforkids.org and go to our website, and we're happy to help you out. We're really proud to be a part of what Ohio is doing in getting their suicide rates down. Thank you so much.
Judy, thank you so much for that wonderful information. We are over time, but this will be recorded. I will be sending this out. Just want to go straight to the reminders for the program. Please let me know if you need additional time to schedule or submit a requirement. Fun fact, screening tools are now available on Spanish on the Seek Resources page. That's a new addition this week. There is, for the end of the month, the pre-work and the baseline data due. Just a reminder that it is an MOC requirement. We have the recordings of the pre-work webinar and the learning session recordings, along with the action period call number 1, and this one will be online as well. So you are able to review those as you can. A requirement for the stipend is the practice coaching call number 1, just a phone call with me and Zainab to talk about how it's going. PDSA's number 1 and 2 due at the end of each month in September and October respectively. Those are also MOC requirements. Want to know how things are going with the screening tools. You should be submitting some data collection through the iPads. Want to know how that's going. That's good for MOC and stipend credit as well. And then if you don't already have a calendar for the action period call number 3 for the end of October, you will be getting one. And just a plug for the Ohio AAP annual meeting. It is back in person, October 28 and 29 in Columbus. We will have great sessions, lots of information going on. And our feature is Dr. Major Kincaid talking about Black maternal health and racial disparities. So that's a lot, but thank you so much for attending today. Thank you again to our great speakers today. I will be sending all this out, including an update this week. Appreciate your time. Have a good week. Thank you.